Hi, my name is Dr. Swapnil Pandey. I am BDS, MDS and PhD in implantology. I am also implant division head in RR Dental Lab, Hyderabad. And today I am here to explain you about fire and forget procedure of complete implant processes. During course of 10 years in my implantology, I faced many challenges in manual technique. So in 2016, I shifted towards the digital technology. But after seeing digital technology, I find out there are many challenges in manual as well as digital. There are different kinds of challenges in both the technology. So that we have bring the new system which is called as fire and forget, which are the combination of both manual as well as digital, and we try to reduce the challenges in both the systems and give you a perfect system which we can use with the ease and which has the advantages of the both systems. There are the different challenges in manual and different challenges in digital technology. So I will talk little bit about the challenges. In manual system, whenever you are doing manual procedure for full mouth cases, there are scarcity of the parts like impression analog, implant analog. The company doesn't supports at the good level and fast, because when the lab orders something, it will take 3 to 4 days to reach that part to the lab. So your case get delays. Third thing is that transfer of your impression. So sometimes it happens the impression is not properly transferred to the lab doesn't properly pour the impression. You take a proper impression, but jig trial doesn't fit on your patient's in the patient's mouth. Okay, your number of visits are increased because of jig trials, jaw lesions, and scarcity of the parts as well as lab demand. So it will overall these all things will cumulatively affect your outcome of the treatment as well as period of your treatment as well as your feel good factor. So during whole treatment, when you are going with the manual technique, you are always stressed. The work is not going in, visits are increasing, it is not according to your wish, and these all factors will become stressful and your life is become stressful. So people generally, because of these stresses, people try to tend to convert their practice, implant prosthetic practice, in the digital way. Now when they invest too much things in the digital like intraoral scanners, they are very costly. It cost you to your pocket, but you don't get as much as results how much you expected while entering into that field. So digital has a different challenges like taking an impression. Taking a digital impression, you will be needing scan bodies, you will be needing digital analogs, you will be needing a provider who will provide a good 3D printed models, as well as a lab who has all digital systems, all this digital machines and accurate machine which he can provide, and your workflow should be smooth in that procedure. So these are all challenges when you are going through digital system. So when the manual techniques gives you sleepless night, you tend your practice shifting towards the digital way. Now challenges with the digital is that your investment for entering into digital implantology is very high. Like you have to buy intraoral scanner first. Second, then you have to get into a digital, all the parts, your inventory you have to change into digital inventory. Like there is a impression coping, now you have to buy for the scan body. There are regular analogs, now you have to get into all digital analogs. So overall, entering into digital field is costly. Then most challenging is that taking a full mount digital impression is the most challenging thing in a digital with the intraoral scanners. There are different kinds of scanner. From 5 lakh scanners, there are 22 lakh rupees scanners are there in the market. But no scanner can give you a sure shot guarantee they will scan your full mouth cases accurately and perfectly. Believe me, no scanner company has given a guarantee of scanning full mouth cases. Yes, people are doing it, but company doesn't says that our scanner is capable of doing full mouth cases. Okay, you can do it, but there are variations. It is not some, the people outside think that you got a scanner, on second day you can scan all your full mouth cases. It doesn't go like that. You have to learn, you have to train. There is a learning curve between that. And also when ridge is resolved, it is impossible to scan those ridges with the intraoral scanner. So there are many challenges in the digital technology as well. So we have invented a new technique which we call as a fire and forget technique, and we have the combination of the both systems, manual as well as digital. And this system doesn't limits you, doesn't limits you to the intraoral scanner. Means if you have intraoral scanner, then also you can use it, and if you don't have intraoral scanner, then also you can use it. So I'll explain you about this technique in detail now. While using our system, you don't need to buy any impression analog, you don't need to buy any scan body, you don't need to buy any analog also, manual also, you don't need to buy digital analog also. All the parts which is required for our system are provided by our lab for the free of cost. We are not charging you for any part, not even a scan body, not even any digital analog. To counter the challenges in digital as well as manual, we have formed a new system which is called as fire and forget system. So which is a golden center between digital as well as manual. You don't need to have intraoral scanner also, but you don't need to have all the inventory also. So you can use this system. Everybody who has intraoral scanner can use, who doesn't have intraoral scanner, he also can use it. And it's a very affordable system and very easy system. You don't require any jig trial, you don't require increased number of visits. All the full mouth cases you can complete in 3 visits. All the full mouth cases you can complete in 3 visits. And you can complete all single arch cases, full mouth single arch cases in 2 visits by using this system. The fire and forget system is a multi-unit level system. It is available for Bioline. It is also available for Noble Biocare, Dentium, Ostium, Norris, Adin. It is also available for Duonami. So whatever system you use, we have this fire and forget system for your implant. If you use Bioline, we are most happy because the system is originated from Bioline only. Bioline company supported us for developing this system to the great extent. We specially thank Bioline system for the development of fire and forget system. Now I will explain you how you can complete your full mouth implant case using our system with the help of RR Dental Lab. Now, first thing is that you have to call RR Dental Lab and arrange for your case coordinator. The person will arrange you a case coordinator who will contact you and ask you about the details of your system, which system you are using, how many implants you have placed. According to the details provided by you, the case coordinator from RR Dental Lab will provide you the scan bodies. These scan bodies can only be used by the users of RR Dental Lab. It cannot be used by any other lab. So these are a little bit locked systems. So you have to send your case to only one lab. That is for sure. Step 1, which is a jaw relation, is a common for both. You have to place the multi-units in the patient's mouth according to angulation of your implant. Once these multi-units are placed, you have to take upper and lower alginate impression. You have to pour the cast and make a wax rims over those casts. You have to arrange upper wax rim according to label fullness of the patient as well as the level of his eyes level. You have to arrange your wax rim according to patient eye level. Plane of the occlusion you have to set. You have to mark the canine line as well as smile line of the patient, so that lab person will know how much teeth he has to design, how much height of your final processes he has to give. According to that, he will be making your coping trial. Third major and foremost thing you have to take is that jaw relation. It's the core of your full mouth case. If you can take perfect jaw relation, then you won't be having any problem in using this system. So always remember that your vertical at occlusion is 2 mm less than your vertical at rest. So you have to first mark 2 points and take the vertical of the rest of the patient, and then according to that vertical at rest, you have to take a jaw relation on vertical at occlusion, 2 mm less than vertical at rest. After taking a jaw relation, you have to secure it properly for sending it to a lab. So you have to get a proper box for securing it. It shouldn't be damaged or distorted during a transport. That care has to be taken by the operator who is taking that jaw relation. This step 2 is also common for manual and digital. In step 2, you have to place your scan bodies on your multi-unit using your parent company screws. Once you place all scan bodies on your multi-unit using your parent company screws, you will check the fit of your scan bodies to your multi-unit. If your multi-unit is above tissue, you can visually check for the fit. If your multi-unit is below tissue, you have to take an X-ray or IOPA for confirming the fit of your scan bodies to your multi-unit. Step 3. Once you are confirmed that your multi-unit are properly fitting with the scan bodies, then you can proceed with the closure of the screws on the top. Once you close the screws with the temporary cement, screw channel once you close with the temporary cement, you proceed with the taking an impression of those scan bodies using alginate or putty material. Step 3. If you own a scanner or you can rent the services of the scanner, then it's very easy. You can scan the scan bodies and tissue directly in the patient's mouth. Sometimes scanners are incapable of capturing resorb ridges. So they cannot, as resorb ridges are there, scanner cannot capture the resorb ridges very properly. So it's difficult to get implant positioning in those cases also. So if you are facing the same problem, you can use our reverse capturing technique. By capturing, you have to take the impression and you have to scan that impression. So using that technique, you can complete your cases in 1 minute and 1.5 minutes using our system. After completion of your scanning, you can send all data to rrdentalcatcam@gmail.com After sending a mail on this email address, you have to uh, contact your case coordinator about the details of your case, and you have to inform him about your data. Now, step 4, and a foremost important step is inspection. Inspection of your taken impression. You have to check your impression for the voids or drags near the scan bodies. If your impression are proper, then you have to secure those impression and send those impression to RR Dental Lab. Step 4 is the inspection of your data. In digital find and forget method, in 24 hours, CAD team will contact you and tell you about the integrity of your sent data. Within few days, lab will provide a coping trial as well as digital model and digital analogs to the doctor. After receiving that, we'll start with the step 5. Now, step 5. In step 5, you have to try the provided frameworks in the patient mouth, and you have to take a final jaw lesion at the point and provide it to, you have to secure those jaw lesion and send it to the lab, the frameworks and jaw lesion. And in final visit, you will get a beautiful prosthesis, passive-limiting prosthesis to your patient. So now you have to understand, this is step 6, you will get the final prosthesis. Now this is the third visit. In first visit, you will be doing jaw lesion and impression. Second visit, you will be doing coping trials and jaw lesion. Third visit, there will be prosthetic delivery. So you can complete all the cases in 3 visits, 6 simple steps. So in conclusion, to summarize all the procedure, we will convert into 3 visits. First visit, step 1, jaw lesion. Step 2, connection fit check of your scan bodies. And step 3, impression of your scan bodies or scan of your scan bodies. So these things you have to do in a first visit. Okay, so first visit will be a little bit lengthy. Second visit, your second visit will be your coping trial as well as final jaw lesion. And third visit, you will have beautiful final prosthesis to sit in the patient's mouth. That's it. So you can complete your case in 3 simple visits of your patients. That's it.